Honourable member for Airdrie Cochrane.
Thank you, Mr. Speaker. At every step, the federal government has mismanaged COVID-19. Rather than be proactive, they hide and blame others. In the spring of 2019, Trudeau dismantled the country's pandemic early warning system. Then, with a world crisis looming, they said closing the border was racist and xenophobic. As a result of inaction, they let COVID-19 into Canada. Later, they said masks were ineffective, then urged their use. And now Trudeau continues to bungle vaccine procurement. To the Minister of Health, how are you managing this crisis with such missteps by the federal government?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And Alberta has one of the best vaccine programs in Canada, with more than 755,000 doses administered so far. Now, despite setbacks from the federal government, as the member mentions, we're getting vaccines into the arms of Albertans as quickly and as safely as possible. We're opening up eligibility faster than any other jurisdiction in Canada, but we're in a race with variants and vaccines, Mr. Speaker. We needed those doses a month ago, 2 months ago, but now we're finally getting them, and we'll get them to Albertans as fast as possible.
The Honourable Member for Airdrie Cochrane.
Thank you, Mr. Speaker, and thank you, Minister. Given many of my constituents in Airdrie Cochrane are thrilled about Alberta's vaccine rollout and the prospect of protecting the most vulnerable, and given inconsistent vaccine supply caused local pharmacies in my riding to cancel hundreds of appointments, and given my constituents and Albertans at large continue to be adversely affected by Trudeau's failure to provide consistent supply, to the Minister, can you update this House on the status of vaccine delivery and the prospect of getting doses in the arms of Albertans?
The Minister of Health.
Mr. Speaker, and the only constraint on our vaccine rollout is supply from Ottawa. Delays in shipments have been extremely frustrating, and we can't give out doses that we just don't have. But that won't let us stop us, Mr. Speaker. As of April 6th, more than 14% of all Albertans have received their first dose. We were the first province in the country to offer vaccines to all residents in long-term care and what we call designated supported living sites across the province. Alberta has vaccinated 80% of those who are 80 plus, 70% of those who are 70 to 79, and 56% of those who are 65 to 69.
The Honourable Member.
Thank you, Mr. Speaker, and thank you again, Minister. Given that Alberta has the most dynamic vaccine distribution system in Canada, with a capacity to vaccinate many more, and given that Alberta recently announced that over 250 more pharmacies, along with family physicians across the province, will soon be able to offer COVID-19 immunizations to their patients, to the Minister, what assurances have been provided to you by the close friend and ally to Alberta's NDP, Justin Trudeau, that this increase in demand can actually be met?
The Honourable Minister of Health.
Thank you, Mr. Speaker. There's no question that vaccinations are our ticket out of this, and we continue to demand more from Ottawa. The Alberta's vaccine rollout is one of the best in the country, with among the highest percentage of doses administered. We've recently expanded eligibility to include 500,000 more Albertans. And as of today, over 1.5 million Albertans are eligible to receive their vaccine. We're also more than doubling the number of pharmacies giving vaccinations, with hundreds more, along with, as the member said, community physicians in the weeks ahead.